Good morning, everyone, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, Chief Darren Rizzi from Mississauga Fire and Emergency Services, and Chris Giles, our Manager of Compliance and Licensing Enforcement. Before I give my update, I just want to congratulate the MPs who were named to the federal cabinet, and in particular, Mississauga Centre MP Omar Al-Gabra, who was reappointed as Minister of Transport. Minister Al-Gabra brings an incredibly strong voice to the cabinet table, and I have no doubt that he will continue to be a resolute champion for our city. I also want to congratulate all the other MPs who were selected to cabinet, and I look forward to working closely with many of them on building thriving communities in Mississauga and bettering the lives of all of our residents. And now for our COVID-19 update. This week, COVID cases are down again in both Peel Region and Mississauga, with Peel Region averaging 20 cases per 100,000, down from 25 last week, and Mississauga averaging just under 24 cases per 100,000, also down from 25 last week. We've now passed the 83% mark of residents 12 plus having received both doses of the vaccine. What's becoming abundantly clear is that we're moving into a very new phase of this pandemic. Because of the enormous gains we've made here in Mississauga and across the province, the Ontario government lifted the remaining capacity limits on restaurants and gyms earlier this week, with other businesses and organizations that currently don't require proof of vaccination also able to see capacity limits lifted if they begin requiring proof of vaccination for entry into their spaces. These include personal care providers, museums, galleries, zoos, and indoor fairs and festivals. Capacity limits can also be lifted for groups who use City of Mississauga facilities for event purposes, such as meetings and weddings. Businesses, organizations, and groups who opt in to have capacity limits lifted must clearly display a sign at their establishments or events that say that they require proof of vaccination for entry. I thank the Ontario government for making these moves. I think it provides fairness for many of our small business owners, as I know there was a lot of frustrations that larger sports and entertainment venues had been allowed to open to full capacity weeks ago. I think the lifting of capacity limits is going to help so many of our small businesses and help accelerate our larger economic recovery. These new regulations are a signal that we are moving closer and closer to a sense of normalcy. I'm incredibly encouraged by this, and I thank everyone in Mississauga and across Ontario for helping us to get to this point. Another signal that things are getting back to normal is a regular Halloween. This Sunday, we're going to see kids across our city out on the streets with their parents to trick or treat. I really couldn't be happier. I was heartbroken last year when public health advice was to forego this annual tradition. So this is a huge milestone. Of course, please be very careful this year. Incorporate a mask as part of your child's costume, if you can. Make sure they take turns at busy doorsteps to maintain distance from others. Have ample hand sanitizer at your disposal. And if you're handing out candy, keep interactions short, wear a mask, and only hand out prepackaged treats. I'm really looking forward to handing out candy myself on Sunday evening and seeing some familiar faces at my door. The Government of Canada last week also lifted its advisory against non-essential travel, another clear indication that things are moving in the right direction. Of course, there are conditions. Starting this Saturday, all passengers on domestic and international flights departing from Canadian airports, as well as rail and marine passengers, will need to show proof of vaccination to travel. And starting on November 30th, you won't be able to fly without a vaccine certificate that has a QR code. I want to thank the Government of Canada and the Ontario government for working together to make it simple for Ontarians. As the enhanced proof of vaccination certificate the province released will also be considered your vaccine travel passport. As of November 8, Canadians vaccinated with any combination of 2 doses of a COVID-19 vaccine authorized by the U.S. regulators or the World Health Organization will be able to enter the United States. The Government of Canada is also actively engaging other countries and international partners to encourage them to recognize those who have received mixed doses of the vaccine. If you do plan on traveling, please familiarize yourself with both Canada's travel requirements as well as those of the country that you're visiting. At the City, we're also looking into how and when we can return to larger community events here. Given that large sports venues are permitted to have tens of thousands of people indoors for the game, I think if things remain stable, it's only right that we can once again start coming together to celebrate as a community. While I'm not sure we're quite ready to host thousands of people in the square for New Year's Eve, we are working on some fun and safe festivities for the days leading up to New Year's Eve. You can probably tell from my tone that I'm feeling very positive, very optimistic about where things are right now. And we do have a lot to be hopeful for as we enter into the holiday season. I'm hopeful things will continue to get better. And that's why I'm encouraging the Government of Ontario to continue its cautious approach to reopening. I know as part of their reopening plan, the Ontario government has set some target dates. For example, proof of vaccination requirements may be gradually lifted in restaurants and bars as early as January 17th in the absence of concerning trends. The plan also sets a target date of March 28th to lift all remaining public health measures, including masking requirements. I appreciate the ambition, but these dates give me quite a bit of trepidation. The last thing anyone wants to see are regulations lifted too quickly and then a sudden spike in cases. We are seeing other jurisdictions like the UK dealing with a surge in cases despite having a large percentage of their population fully vaccinated. I encourage the Government of Ontario to remain cautious and not hesitate to adjust reopening plans if the health trends warrant it. We have to protect the enormous gains that we have made. I also want Mississauga residents to know that while our case counts have steadily decreased, we have seen some concerning trends in Mississauga with elevated COVID-19 transmission in some areas. Peel Public Health is working hard to understand exactly why this is happening. But what we do know is that there are some neighbourhoods in Mississauga with a lower vaccine uptake than the rest of the city, leading to a large number of susceptible residents. These areas include Burnhamthorpe, Applewood, Dixie, Cooksville, and Mississauga Valley. And that's translated to unnecessary pressure on our hospital system. Right now, Trillium Health Partners has 22 COVID hospitalizations and 5 patients in the ICU. And that's compared to Brampton's William Osler Hospital with a total of 8 COVID hospitalizations and 1 person in the ICU. Trillium has the most COVID inpatients compared to any other hospital in Ontario. We need to do everything we can to protect our hospitals, and that means going to get vaccinated. I'm urging everyone in Mississauga who hasn't received their first or second dose, particularly in the neighbourhoods I mentioned, to go and get their vaccine as soon as possible. Peel Public Health is increasing the deployment of mobile community clinics and outreach in these areas with the help of local agencies. We also have pop-up and community clinics happening each and every day throughout Mississauga. Today, for example, you can simply walk in at the Wellfort Community Health Centre at Westwood Square anytime between 2 p.m. and 7 p.m. to get vaccinated, or tomorrow between 11 a.m. and 4 p.m. Peel Public Health Fairview Clinic will be offering the vaccine between 10 a.m. and 2 p.m. tomorrow and Saturday. And a vaccine clinic for Black, African, and Caribbean communities will be held at Praise Cathedral Worship Centre tomorrow and Saturday between noon and 6 p.m. Peel Public Health is also running clinics at numerous schools across Mississauga, including Father Michael Gates, Father Daniel Zanin, Our Lady of Mount Carmel, John Fraser, and St. Alfred. For information on dates and times, please visit the Region of Peel's website. Please don't compromise the progress and the things we have to look forward to by waiting to get vaccinated. As I said earlier, we're seeing major reopenings happening right now, and it's a very exciting and promising time for our community. Please, I urge you to play your part. The last thing anyone in our city wants to see is the reintroduction of restrictions in Mississauga because some in our community simply won't get the vaccine. I know everyone wants to come together with families and friends this year to celebrate Diwali, Hanukkah, Christmas, Kwanzaa, and of course, New Year's Eve and New Year's. Before I bring up Dr. Lowe, I just want to give a final update on our city's Thanksgiving food drive campaign. Our goal this year was to raise $400,000 and 200,000 pounds of food for the Mississauga Food Bank. And thanks to the incredible generosity of residents, businesses, community groups, students, and more, we not only met our goals this year, but far exceeded them. Mississauga, from the bottom of my heart, thank you for raising over $650,000 and over 370,000 pounds of food for the Mississauga Food Bank. We truly couldn't have done this without you, and I'm incredibly proud and grateful to be mayor of such a generous and compassionate city. Since we launched this campaign in 2015, we have raised over $2.5 million and over 1.87 million pounds of food. That's food and funds for almost 7 million meals to feed our hungry neighbors. There is no doubt in my mind that we are the most compassionate and generous community in all of Canada. If you can, I encourage you to continue to donate to the Mississauga Food Bank so we can provide healthy food to community members year-round. And now I'd like to invite up Dr. Lowe for his update.
Thank you, Madam Mayor, and good morning. Mississauga's COVID case rates this week are 23.7 per 100,000, with test positivity at 2.1%. Just under 84% of eligible Peel residents have completed a 2-dose series. There are now 26,000 first doses and 97,000 second doses remaining in order to reach 90% 2-dose coverage amongst our eligible population. That's right, just under 120,000 total doses stand between us and 90% of our eligible population vaccinated in Peel. As Mayor Crombie noted, that focus really must be on the lower vaccination coverage seen in certain neighborhoods in southeast and south central Mississauga. Those who are unvaccinated and are living in these communities have been admitted with COVID-19 in greater numbers at Trillium Health Partners. We have also seen more exposures and outbreaks in schools and social activities in these areas of the city. So I am particularly grateful that the province is moving gradually, especially as we continue to monitor this concerning trend identified in these neighborhoods. It's important to note that with looser measures and colder weather, these low coverage rates pose a risk to lives, our healthcare system, and our overall progress to date. COVID continues to spread, seeking the easiest path to infection, which is increasingly among those who do not have 2 doses of the vaccine. Vaccines reduce the risk of severity and death, and vigilance with measures such as masking, certification, and self-isolation if sick will keep trends stable, maintain our hospital capacity, and preserve in-person learning and our community's openness as much as possible. For those who are still waiting to get vaccine, I know you have reasons, and I also know that many of those reasons are fears. I encourage you to talk to your pharmacist or doctor or a caring friend who will answer without judgment. And then, when you're ready, visit peelregion.ca/COVID-19 vaccine to book or walk in. If you get your first dose today, you can comfortably complete your full protection ahead of December holiday season. That certainly is the greatest gift that you can give to the people that you love. We also continue to deliver 3rd doses in line with ministry guidance, but our priority continues to be 1st and 2nd doses for those who have no protection at all. This focus will bring us to the exit sooner, and that same principle will apply when children aged 5 to 11 become eligible, which we hope will be very soon. There are more than 120,000 children aged 5 to 11 living in the region of Peel. And while children are usually at lower risk of severe outcomes from COVID, they occasionally do have rare and severe outcomes and may well also pass it on to each other or to someone at home who's at higher risk. So we are ready to vaccinate everyone who wants vaccine for their children as soon as it's approved and as soon as supply comes available. Full details of our fall plan for vaccines and locations will be updated frequently at our website, which once again is peelregion.ca/COVID-19 vaccine. Please don't delay any further. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Loeb. And before I take questions from the media, I'm going to invite up Chief Darren Rizzi to tell us about a truly inspiring story about the life-saving heroism of one of our own employees right here at the City of Mississauga. Chief Rizzi, the floor is yours.
Thank you, Madam Mayor. I'm here today to share an exceptional story involving Chris Giles, the Manager of Enforcement and Compliance at the City of Mississauga. On September 17th, Chris was out with his wife when he came across a young woman who had collapsed in the street. The woman had her 3-week-old baby with her. Chris stopped his vehicle to see if the woman was okay, and Chris quickly realized she was without vital signs, which means she was not breathing and she did not have a pulse, so she needed immediate help. Chris, a former police officer, quite literally saved this woman's life by performing CPR until paramedics and firefighters could arrive on scene. The woman was suffering from a heart-related issue, and without CPR, the story may have had a very different ending. Yesterday, at the Mississauga City Council, I presented Chris Giles with an award of recognition for his quick thinking in this emergency situation. We commend your bravery and quick thinking. You exemplify caring and selflessness. On behalf of Mississauga Fire and Emergency Services, we thank you for your courage and actions. CPR Awareness Month is taking place in November, and I would like to call up Chris Giles to talk about the importance and value of first aid and CPR training.
Thanks, Chief Rizzi. Madam Mayor. The story you just heard from Chief Rizzi has garnered quite a bit of media attention over the last couple of days. And while most people will hear the story about a stranger who saved someone's life, what I want you to remember today is how important it is to get basic first aid and CPR training. This woman survived her event because someone near her had this training, and she is a mother and a wife. As Chief Rizzi said yesterday, November is CPR Awareness Month, and I wanted to use this story and share it with you to remind you how important this training is. Basic first aid and CPR training were primarily developed for the average citizen to provide basic emergency comfort and care in the absence of professional medical care. This training provides a crucial bridge between the time the emergency event begins until professional life-saving procedures can be implemented. Although these incidents are somewhat rare, it may not always be a stranger to whom you provide aid. It may be one of your own parents. It may be one of your own children, a friend, a coworker, or another relative. This is the very reason why it is important for everyone to obtain this basic certification. The training is simple, it's easy to understand, and you can obtain it online. Just consider this: you'll never be asked why you stopped and helped someone. Thank you, and over to you, Madam Mayor.
What an incredible story. This really is one of the finest examples of heroism I have ever heard. And the City of Mississauga couldn't be prouder of you, Chris. Now, along with Dr. Lowe, Chief Rizzi, and Chris Giles, we're all willing to take questions from the media.
Mayor Crombie, your first question comes from Natasha O'Neill at The Pointer. Go ahead, Natasha.
Welcome, Natasha.
Good morning.
Good morning.
I have two questions for you this morning, Mayor Crombie. The first one is about the Mississauga Blackhawks. I know that the city doesn't have jurisdiction to make the team change their name, so I'm just wondering if you've been advocating them to change their name in any capacity?
Yes, certainly, Natasha, we have, and we're working very closely with our community services. Our acting commissioner, Jody Roblius, has been speaking with the team, and I know that changes are being planned and forthcoming. These things take a little bit of time, so just asking for a bit of patience. I believe changes are forthcoming.
Thank you. My second question, when was the last time that you were included in a diversity and inclusion training, and did this include a portion about Indigenous issues?
So that is a very good question. I have been in diversity and inclusion training a couple of times, but not within the past 18 months. I think it was previous to this, and we do D&I training. We do also do governance training regularly. So it always includes issues pertaining to all marginalized, racialized individuals, and of course, Indigenous issues as well. Thank you for the question.
Mayor Crombie, your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Mayor Crombie.
Good morning, Steve.
I wanted to ask you about where the city's at in terms of employee vaccinations. Based on the numbers that were provided last week, there could be over 1,000 employees that aren't vaccinated. So one, do you have an update on the number of employees that have proven they're fully vaccinated? And two, have you put any more thought into, as we're approaching this November 1st deadline, whether there'll be additional disciplinary measures for employees that aren't fully vaccinated?
Right. So the November 1st deadline is firm, but as you know, over 90% of our employees who have disclosed are double vaccinated, are fully vaccinated, I should say. But with respect to the part-timers and some of our My Way employees, because of the nature of their part-time or shift work, they have not had the opportunity to disclose yet, as of yet. So that deadline for those employees has been extended, and we're still collecting that data. So as soon as it's announced, we will let you know, but we're still in the disclosure phase for some of our employees, and they make up the part-timers who work at our recreation centers, our cultural facilities, arenas, etc., and also our My Way, our ATU employees at My Way.
Follow-up, Steve?
And another kind of deadline-related question, the earlier this month, the city announced it was going to have 10 of the photo radar cameras, 10 additional photo radar cameras in place for this month. So looked at the map this morning, and there's 3 in place today. At least it's been reported by the city.
Yes.
Is the city going to hit its deadline of, by the end of the month, having 10 additional cameras in place?
I'll have to get back to you. Chris, do you have any information on that? No, we don't have information, but those are those automated speed cameras. So that is the plan. There's only 2 actually, Steve, right now, not 3. More are coming, but I'll have to get back to you on whether or not we'll meet the deadline towards the end of the month. But certainly more are planned. Next question.
Crombie, your next question comes from Declan Finnegan at Mississauga. Go ahead, Declan.
Good morning, Declan.
Good morning, Mayor Crombie. How are you?
I'm very well. How about you?
I'm fine, thank you. Just with respect to the neighborhoods, the specific neighborhoods in Mississauga you've identified, I noticed the list, today's list is somewhat different than last week. Fairview, Arundel, Sheridan, Rathburn,
right,
not on last week's list. Now this week's, they're not, and new list, new areas this week: Cooksville, Burnhamthorpe, Dixie. Are you seeing? Are you seeing some improvements in some of those areas listed last week?
Yep.
And now some additional lower rates in new areas identified this week?
I think this list is inclusive of the neighborhoods I mentioned last week, and others have been eliminated from the list. They are still watching all of our neighborhoods for the vaccination rates, and I'm going to invite Dr. Lowe up because, of course, those are Peel Health statistics, and he can speak to those neighborhoods that were not mentioned this week as they were last. Dr. Lowe, over to you.
Yeah, great. Thank you.
Thanks so much, Madam Mayor, and thank you for the question. To be clear, I think the neighborhoods, in terms of their boundaries, are obviously a little more fluid, which is why our main focus and the overarching message is South Central and Southeast Mississauga. There are a number of neighborhoods there which are seeing lower than usual vaccination rates. This has meant that overall, amongst the 3 municipalities in the region of Peel, Mississauga's full vaccination rate completion is actually 2 to 3% below that of Brampton and Caledon's, and it actually does present that challenge that we are now seeing borne out at Trillium Health Partners, which is having the highest number of COVID-19 inpatients in the province of Ontario. Thanks for the question.
Great, thank you. And one more question for Mayor Crombie, if I may.
Yep. Sure, Declan.
I just wondering, in general terms, I know there's, in recent weeks, the last couple of months, there's been so much confusion on the part of residents and others, unsure of where proof of vaccination is required, who's, and so forth. And I know with guidelines coming almost every day or weekly from the province, it's like hitting a moving target. Is there a sense now that things are less confusing and
I think so.
approaching a time where things will be more, have a handle on things more?
Yeah, that's an interesting observation. I think that people should just assume they should have their vaccine passport with their QR code ready in their wallets or on their phones and make it easily accessible, because I think they should assume that no matter where they go, they're going to be asked pretty much. It used to be just for indoor dining. Now anytime you enter any facility, whether it's an event space, a sporting venue, a restaurant, indoor, outdoor gym, you will be asked for proof of vaccination. So I think people should just assume that. I thought Dr. Lowe would like to come and speak to this as well. So yes, be ready with your QR code. Dr. Lowe, over to you.
No, thank you, Madam Mayor. Thanks for the question. It's important to highlight that with the lifting of capacity limits in Ontario right now, the key measures that we must remain vigilant with are masking as well as the vaccine certificate program. The vaccine certificate program is in place to protect individuals who are unvaccinated in settings where precautions such as masking can't be consistently maintained. Certainly Mayor Crombie highlighted that there are a number of places where it is required by law, and the province in lifting capacity limits has also put a new proviso in that places can opt in to the vaccine certificate as well, including places like places of worship, including other meeting and event spaces, should they choose to implement vaccine certification. So this is how we will continue to remain vigilant in protecting those who are most vulnerable, which is increasingly those who are unvaccinated, and making sure that we can also preserve our progress and avoid large-scale closures and lockdowns. Thanks for the question.
Next question, please.
Next question comes from Pooja Luthra at iMedia. Pooja?
Welcome, Pooja.
Yeah, hi. Good morning.
Good morning.
Mayor, I would like to know that have you encountered any cases related to forging of COVID-19 vaccine documents in Mississauga or in Peel?
I do not have any reports of any forged documents, and I'm going to ask Chris Giles. He's shaking his head that he has not encountered. You want to speak to documents? Chris Giles is going to come speak to it. Thank you.
Thank you so much.
Thank you, Mayor Crombie. And sorry, could you go with the question again?
I would just like to know that if we have encountered any cases related to forging of COVID-19 documents here? Vaccination related?
No, we've not encountered any type of complaints such as this, but I will point out that if that did occur, that would be something we would turn over to local authorities for investigation.
Okay, thank you so much. My next question is for Dr. Lowe.
Thanks, Pooja. Go ahead with your question.
Yeah, good morning, Dr. Lowe. I would like to know that CDC has said that immunocompromised people may need fourth COVID-19 vaccine booster. So do you have to, what do you have to say on this? And do you think it would be necessary here in Ontario as well?
At this point in time, individuals who are unable to mount a robust immune response are eligible for a third dose of vaccine. This has been proceeding in Peel Region via referral. It is the current eligible groups for third dose vaccines in Ontario have been long-term care residents, retirement home residents, and then there's a whole list of individuals who are on active therapy that may be immunosuppressive and also may have immunosuppressive conditions such as cancer. So I encourage people to look at the Ontario website or visit peelregion.ca/COVID-19 vaccine for third dose eligibility updates. That is already proceeding here in Ontario. Thanks for the question.
Are there any further questions?
Yeah, your last question for the day comes from Khaled Salama at My Second Home TV. Go ahead, Khaled.
Welcome, Khaled.
Just having an additional question today for our hero, and that question will come first, okay?
Certainly.
So, Chris,
please.
Yeah, thank you so much. Chris, thank you so much for your heroism, but I have a small question. Did you think of any possibility that you may get COVID or any other infections when you were trying to perform the CPR?
Quite honestly, that didn't enter my mind at the time. I think the situation dictated that, this woman was in serious distress, and my intent was only to provide her with an opportunity to get the care she needed.
Bless you. Thank you so much. That's great. Thank you. And Madam Mayor, you mentioned certain neighborhoods, which is little bit highly affected with the COVID still. May I ask, what's the drive or why they are hesitant so far of getting the vaccine?
Well, that's a very good question. I wish we knew the answer. So certainly we see the vaccine rates lower in a few neighborhoods and communities in Mississauga. That's not to say they're low. That is to say they are lower than our average in Mississauga, which of course is 83% like the province. So we are encouraging residents from Burnhamthorpe, Applewood, Dixie, Cooksville, and Mississauga Valleys to please, if they haven't gotten their vaccine, to go out and do so. I don't know what it could be attributed to. I don't want to speculate necessarily. Maybe there's areas of higher density, greater transition, or more transitory. Dr. Lowe, do you want to speculate? He's going to come and give you his opinion on why rates could be lower in those neighborhoods. Dr. Lowe?
Thank you, Madam Mayor. Thanks for the question. No, we actually are actively working with community organizations and agencies to understand the reasons why there may not be as much vaccine confidence in some of these neighborhoods in southeast and south central Mississauga, and of course working with these community agencies to have community ambassadors out there. We've had people going door to door. We're working through community leaders. We're working and bringing mobile clinics to locations that are close to and near really familiar places with familiar, basically delivering vaccines in familiar places with familiar faces. So we know that there's a wide spectrum as to why people may not have confidence. They may have mistrust of government. They may have historic mistrust of institutions, of the healthcare system. They may also have barriers in respect of culture, socioeconomic status, et cetera. We're working together with community agencies to address those as part of our last mile strategy. Thanks so much for the question.
Appreciate it. And the follow-up would be maybe for yourself also and Madam Mayor. Yesterday, the Brampton Mayor mentioned that he wants to see the New Year's festivities and parades like Santa take place. And with the lifting of the capacity measures and whatever, do you think we can see parades this year? Because actually our city missed a lot lately, all the festivities that everybody lives on.
You know, I think it's a great point, and I would highlight that the festivities are missed, but with good reason. We were in the midst of an unprecedented human health crisis last year. We had a largely susceptible population. I will concede that we are in a very different position this year, but I think it would be foolish to promise anything. I think there's a recognition that this virus has, shown its adaptability and its willingness to continue to spread. And I think, frankly speaking, a lot of the people who are remaining unvaccinated are giving it a wide open goal. So I think the more people that get vaccinated, the more certainty we can have that the exit strategy that has been outlined by the provincial government comes to fruition, and that many of these things that we used to enjoy, just like any other natural disaster, you take the steps to actually prevent it, and then eventually the disaster goes away and life goes back to normal. Thanks so much for the question.
Khaled, if I may add one thing, and not with respect to the public health guidelines, which of course have been in force up until now, it's a bit restrictive to plan and organize an event like a parade with little lead time. You know, the event organizers need to secure bands and floats, etc., and it takes a considerable amount of time to organize an event of that nature. So because there was so much uncertainty as to whether or not we would be opened at this time and there would be fewer restrictions, it really doesn't leave anyone much opportunity to plan an event of that magnitude with 4 to 6 weeks lead time, which is very little, because I know they plan these things all year long and secure all the right acts.
That concludes the questions for today, Mayor Crombie.
Thank you. Thank you all for joining us.